Welcome to the presentation How Universal Ethical Situations are Expressed in Different Contexts. My name is Andrea Sturm and I'm delighted to present you the qualitative results of an international online survey. Practitioners of all member countries are expected to comply with the World Physiotherapy Association's Code of Ethics. An understanding of ethical practice internationally and its challenges for physiotherapists to translate it into their daily work is needed to inform how all physiotherapists can be best equipped to be moral agents in the context of their practice and societies. The research is part of a larger project, the ESPI-Study, with the aim to describe the ethical landscapes of physiotherapists in all 5 World Physiotherapy regions. The optional open question at the end of the survey aimed to discover ethical situations beyond what is already known from existing literature, experienced by physiotherapists internationally, and to describe contextual shades of the reported situations. The survey invited practicing physiotherapists and students to participate. We created the survey in English and did a pilot study among 8 colleagues from Australia and Europe. It was divided into 3 sections. The last section was an open question, optionally asking the participants to describe an ethical situation that they experienced, which was not on the list. It allowed the respondents to phrase their own dilemmas or to express local nuances of the universally described survey items in section 2. The survey link went online in October 2018 and was promoted by a license-free advertisement. The study was also introduced by a blog post on PhysioSpot and a pop-up at the Physiopedia wiki sites for 8 weeks. We wrote emails to all World Physiotherapy member organizations with the request to share the survey link with their members and handed out printed invitations at the World Physiotherapy Conference in Geneva 2019. Descriptive statistics and qualitative methods were used for the data analysis of the participants' individual responses to the open question. Here you can see an example of the coding of the individual responses. 2 researchers independently color-coded the data. 5 different categories became apparent. Issues closely aligning with the existing survey questions were coded as yellow. Issues related to survey questions but expressed differently to their intent were coded as green, both including the number of the original survey question. New issues raised outside of the existing survey questions were coded as aqua. The black codes were allocated for those participants stating nothing more to add, and the teal color was used to mark unrelated or unintelligible responses. One response could contain data on more than one ethical issue and more than one category. In this infographic, you can see the number of respondents of each country. 1,212 individuals from 94 countries took part in the survey. 846 participants, these are 69.8%, completed the entire survey. A reflection of the world's circumstances could already be recognized within the demographic data. For example, all participants from China explicitly stated that they were from Hong Kong. Many participants from the United Kingdom indicated additionally that they were Scottish. 354, these are 29.2%, replied to the optional open question at the end of the survey and shared their individual experiences. More participants than expected responded to the open question from the Africa region and less than expected from the Europe region. This figure represents the relationship of the about 400 identified issues in the coding categories yellow, green, and aqua, with the original ethical situations listed in the survey. The yellow responses were closest to the questions asked in survey category 2. The green responses were related but raised those issues somewhat differently. The aqua responses were even further away from the questions raised in the survey. Among the directly and indirectly related responses, over a quarter of the about 400 identified issues were pertaining to just 3 ethical situations. We identified 49 variants of professional misconduct of other health professionals, including physiotherapists. This could look like physiotherapists making critical incidents reports, but were warned by the medical doctor because their career was then in danger. Or physiotherapists practicing without license, although the governing body was aware but not intervening despite numerous requests. Misconduct was also described as translating and reproducing research without original author's permission. In this universal ethical situation, we identified 36 different shades. Bullying or harassment of physiotherapists was reported from disrespectful or insulting behavior of other health professionals towards physiotherapists to workplace bullying between managers and physiotherapists. Peer-to-peer harassment in the professional association was reported, as well as physiotherapy clinics badmouthing other clinics to doctors and patients in self-promoting efforts. Conflict with other health professionals about patients' management presented 24 various expressions within the data. This could look like unnecessary shots or even surgeries due to overpower of orthopedic or neurosurgeons, or a physiotherapist in an aged care setting telling their suspicion of diagnosis to the doctors who did not find it necessary to investigate but brushed it off and left the patients to deteriorate. In the Aqua responses were voices raising issues expressing disempowerment, a lack of physiotherapy accreditation and regulation, and lower levels of physiotherapy identity and recognition. In some respects, the participants in the Aqua responses felt on the periphery and marginalized. For example, physiotherapy associations were described as weak in quality control. Participants from India reported untrained people would do the job without any degree and highlighted the need for a code of conduct for physiotherapists. At the time we conducted the survey, India was not a member of World Physiotherapy, but now it is. In this theme, other healthcare professionals were described as thinking physiotherapists would just do chest therapy and mobilization, and their job would be easy and overpaid. A lack of awareness of physiotherapy in the society as well as on the academic side when standing eye to eye with other healthcare professionals was reported, as well as people who would not know what physiotherapists could treat and therefore get convinced for surgery too early. Voices in this theme were money and also business arrived in the health sector of Switzerland. Now money is more important than the people who work for the patients and the patients themselves. Or this novel field has already turned into a money-making business in all the countries, which is of a great concern. Political threats were identified as another new theme in this research. One participant reported cases of surveillance when they were treating victims of possible political violence and government brutality and the possibility of electronic bugging. Expressions of suppressive professional political environments were described as either following the hierarchy's direction or not to progress their careers. A removal and demotion of a physiotherapist who presented challenging information regarding research in an educational setting which was not appreciated was reported, or professional organizations and leaders intimidating members into compliance and silencing dissent. Physiotherapists are confronted with contextual, systemic, and political ethical challenges internationally. They are not consistently prepared for and adequately supported in the ethical complexity of their workplaces. Disagreement and miscommunication with other health professionals create tensions and affect the quality of physiotherapy treatment. Abuse, exploitation, undue pressures, and unsafe work environments make physiotherapists thinking about leaving the profession. What does this mean? We suggest that physiotherapists internationally need skills and support to respond to the socio-cultural and political dimensions of ethical practice. Therefore, more locally informed and situated ethics research is needed. We recommend embedding context into ethics teaching and codes for a better alignment with local requirements. Skill training could help students to be practitioners remaining true to values and be resilient even if professional principles are infringed. This means further to act for a change when confronted with injustice, discrimination, abuse, or exploitation within healthcare settings or work systems. Policymakers, professional and political leaders are in positions to act for these changes and to advocate for a fair share of responsibilities among involved and contributing persons, institutions, and stakeholders. This will help creating a constructive ethical climate that appreciates the work of physiotherapists. We also need to educate society and other health professionals about the scope of the physiotherapy profession. Thank you for your interest, and we would love to hear from you.